states have strict services, programs that really support the deaf and hard hearing. But here in Wisconsin, they have nothing. So what we try to do is figure out what's the best services, what are the best programs for the deaf and hard hearing. And so we take different committees, groups, programs from other states and really try to figure out what's going to work best for Wisconsin. Other states, they have that. They have different programs, different groups. So we're really trying to match that and try to figure out what's best for Wisconsin with mental health. Two people the same. Who's first?
Okay. My question is about like the mental health down in Alabama. Do you guys consider that a good resource to bring to Wisconsin, something like that, when you talk about like the different states having straight approaches?
That's one of the programs and services we're looking at, but we're also finding different states. We want to add not only that, but just different states throughout the country to bring in the best programs to Wisconsin.
So you're not necessarily choosing one model to look at, but parts and pieces of all the different states' models to make our own?
Maybe. That's why we have a committee. That's why we need that, so that they can help to decide what's going to work best and what's going to be the most professional and appropriate service for the deaf and hard hearing. We really don't know at this point. We're still working on it.
Have you ever considered about measuring the costs of what it would take to give direct services compared to paying someone to go out of state? I'm wondering if that's something that's being considered.
That's really something we're working on right now. I'm waiting for the committee to give me that information. We're going to keep going. We have 12 different active communities, and we've only talked about 2, so let's get down to business. We got through the most complicated ones, and now we're going to do more of the straightforward. The Advocacy Committee. Do you know what the difference between legislative and advocacy committees are? No? Nobody? Learn something different as introduced today. The legislative focused on setting up laws for the state through the government. The Advocacy Committee works with one-on-one to help support your businesses to understand understand the difference between advocacy and legislative. Interpreter, we make personal contacts with businesses to make sure that access is provided. An example is a deaf patient enters a hospital. I need an interpreter. No, you don't get an interpreter. You don't have that access. So they go back to that same hospital Sunday and they say, I need an interpreter. And the hospital says they won't provide it. That's a problem. places will provide interpreters, but this particular clinic will not. So what does our committee do? They contact that hospital and WAS and explain the law one-on-one and let them know the situation and the importance of having an interpreter. They always seem to have an excuse about something, and if they have an excuse about maybe why they can't afford it, if the interpreting providers are closed, but it's not an excuse. They need these services. So it's a strict, tell them straightforward that they have to follow. That's part of the advocacy committee. That's how they support the deaf and hard hearing.
So that kind of answers my question about advocacy. I was wondering exactly what would be the difference between the two, and so that really helps me understand.
Very good.
I'm just curious as to how, like, if one deaf person comes and says, this specific hospital is not providing me an interpreter, will the advocacy committee go and talk to the hospital, or does it have to be 2 or 3 or 4 people complaining about that same location?
One person will let you know, and we encourage people to document their situation so we can follow up and give them the services and provide them with what they need. Just so you know that everyone in the committees are all volunteers. They do not get paid for this. So how many complaints does it take for us to act on a situation? It's really up to their availability. This is not their job, this is their volunteering for you to help the services. So it's really about how we can be available. We try to do as much as we can. It is important to have those services. We really try to meet up and get everyone's services provided. We also want to empower deaf people, give them that deaf power in order for them to do it on their own. We have leadership trainings, maybe I have.
It's a good time to switch anyway, so. Pardon me?
Lauren McKinney.
Lauren.
And after that?
My pencils are here. Do you have an extra one?
And it comes clean.
This is